caring is really something that is a blessing and it's a gift that we see because not everybody can do that. Hi, I'm Dr. Mari Joanne Joson. I'm a palliative medicine specialist at the Makati Medical Center, Philippines. Some of the examples of psychological, spiritual, and emotional challenges of our caregivers are very dynamic. So there are two types, because the caregivers are sometimes the family members or sometimes they are the real caregivers who are trained. So for the family caregivers, the emotional roller coaster ride is really when they're diagnosed, their loved ones are diagnosed with the cancer itself. So it's the acceptance. So it's not only the patient but also the caregivers who are trying to accept the cancer diagnosis and how they will deal with it from a day to day, from a month to month, from treatment up to the end of their life. And for the caregivers who are trained, it's really actually how they're going to take care of the patient as well as the family when they're confined, when they're doing treatment, or when they're already at home. How will they set up the home? How will they need to put it up in the sense where they need to put equipment, purchase medications, and then deal with the symptoms. So that's a big emotional burden in terms of planning for what to expect. And in terms of other aspects of caregiver burden is also the physical. So physical meaning when we deal with what's going to happen and then how are we going to take care of our patients. It's also something that we need our caregivers to prepare because it's a long journey. So we look into their physical strength for the formal caregivers, if they're able to carry the patients, put them to bed and pull them up. So the caregiving depends on if they're trained. If they're not trained like the family caregivers, then we have to give them sessions on a weekly, on a monthly to assess if they're able to care for their patients properly. But for those who are trained, it's easier. But we have to also look into their physical well-being from time to time because they may depreciate because of the care that they give to the patients in time. It becomes more complicated. Probably at the first journey of the illness as they go to an outpatient visit, and then after when they get really sick, so they get bedridden or they get in a wheelchair. So the physical endurance needs to be taken care of as well. Some ways where the general public can help our cancer patients and their caregivers is an example would be in the workplace, in their community, in the school, in the church as well. So these are the areas where our patients, once they are willing to talk about their illness, would seek some form of help. And in return, the groups that I've mentioned will also be able to get support from the rest of the community where they can help in terms of buying their medications, as simple as bringing the patient on trip to the hospital because they have no formal caregivers or the family members are not available. And also the church as a group can also give some form of spiritual care. So the priests, the nuns, and even some other religious groups that can do some group dynamics where they can discuss about their spiritual existential issues. That will help our patients also deal with some anxieties in terms of their existential issues. So the public will be able to help our patients and their caregivers when they will be open about their diagnosis and prognosis also. So being a Filipino caregiver really involves a lot of physical and psychosocial strength. We Filipinos are very hardworking and very compassionate. So we try as much as load as we can and tend to forget ourselves as well. So there are things that we need to really process as palliative medicine specialists because we look into the areas of wellness and domains where we can help them in terms of physical, emotional, psychosocial, and spiritual. So we tend to keep it to ourselves, and then our physical health also is affected. So we try to help them in those five domains so that they'll be able to journey with their patients with full capacity. The caregiver fatigue, what we call caregiver burnout, is signs of physical decline when they're already getting sick. The emotional and psychosocial is when they get depressed, because the impact of caregiving, sometimes they don't have time for themselves. They don't have time for their work. They get the leave from their work, so that entails lesser income because there's a financial burden already when they leave for work and then they care for their loved ones. Apart from that is sign of depression because of losing some sense of hope. So apart from that is also the psychosocial aspects where they some kind of lose sense of hope despite giving the care, and they don't get the results that they want. So they have to get that journey where they feel some loneliness, some form of getting away from their loved ones, which is also a very important aspect of care where psychosocial is involved. So we need to have friends, we need to communicate, we need to connect with a lot of people around us, because that gives us some form of strength and hope that the day-to-day will be better. First and foremost, a lot of things are in their head already. So we try to encourage them to do some journaling. There are evidences that have shown that journaling helps them be focused, be mindful of the things that they need to do, because there's a lot in their plates already. So we do one at a time and make some checklists, because that will help them focus on what's the most important thing and deal with the rest later on. And the other parts would be asking what would make them feel happy in what they do. So it's not the same for all caregivers or family caregivers, so to say, because each person has their own thing that they like to do in terms of like physical. If they want to do dancing, they want to do physical activities, they want to do swimming. So these things needs to be brought up and being discussed through their journey, because that's the only way to help them to know which one would help them go on a day-to-day and help them also mentally, physically, because it's what they want. And then when they do caregiving, that seems to be pushed away. So nobody asks them if they need to do this for them to be able to live on the next day. But when they go to us, palliative medicine specialists, we talk about these things and then prioritize, not to do everything, but at least one happy thing to make them feel better and then feel grateful, actually. So it's more feeling of gratitude in the things that they do, because caring is really something that is a blessing and it's a gift that we see, because not everybody can do that. Okay, what are the qualities of a good caregiver? I believe it's not a clear-cut case, because it depends on the family dynamics, number one. Second is the personality of the patient that is being cared for. We try to adjust on how we deal on a day-to-day, because journeying with a cancer patient is not really easy. So we have to really be, number one, open and accepting to what we're facing. And then second would really be creative. We have to be creative, because if there's no creativity along the way, things might go in a very monotonous day-to-day, and we need to be doing something that will make us both happy, the caregiver and the patient themselves, for us not to feel that caregiver burnout. So we have to look into ways where we can be doing things like in a normal way, and not thinking about patient who is really sick, but giving our best on a day-to-day, because that's about quality of life, enjoying every moment and every minute that's given to us until our last breath. For tasks of caregivers that we do for cancer patients, it depends on the stage of their illness. At the start of the cancer journey, when they're very physically well, but they're diagnosed with a chronic illness, so it's probably just preparing for the treatment and bringing the patient to an outpatient visit on a scheduled basis. When we come to the middle part of the illness, right? So this is a time where they have symptoms, they have sleepless nights, they have pains. So something that we need to prepare mentally in that case, understanding the course of illness, because a cancer journey in terms of physical is like a straight plateau and then suddenly declines. The expectations would really differ when the patient have their symptoms already and in decline in terms of physical state, emotional state, because in a cancer journey, it's really case to case, no? Depending on what treatment they have. Probably at the start, they'll be okay, but during treatment, they'll have these severe symptoms. So the caregiver needs to be prepared with that kind of setup so that they also be equipped in terms of not being the first one to panic and bring their patients to the hospital or call the family that this patient is suffering from that, because the mere presence of the caregiver is already actually the support and for the patient to also cope with the illness that he or she's having. So it needs to be a big heart, a strong mind, and somebody who has really a big organizational skills, because they have to really know when and how to act appropriately. The support services for caregivers are different in terms of community, so that the church will have that. I will also advertise the Ruth Foundation, where the Philippine Society of Hospice and Palliative Medicine work with closely. They can call and have support in terms, or even remotely, and have discussions with the counselors to deal with their psychosocial and emotional distressors also.